Hi, this is Chapter 6 Substance Use Assessment. Okay, as far as alcohol statistics go, most used and abused psychoactive drug is alcohol. Given rates of alcohol use, it is not surprising that many patients in hospital and primary care find themselves with alcohol related disorders. Morbidity and mortality data reflect adverse consequences of excess alcohol use. About 37% of traffic deaths in those ranging from 16 to 20 years of age are alcohol related. Emergency department visits related to alcohol consumption have nearly doubled since the early 2000s. Over half of American ages 12 and older report being current alcohol drinkers. Think about that. For adults aged 18 to 25 years old, almost 40% report binge drinking greater than 5 drinks per occasion, and almost 13% report heavily used binge drinking on greater than 5 days in the past 30 days. Thus, alcohol is the most used and abused psychoactive drug. People like to drink. Given the rates of alcohol use, it is not surprising how many of the hospital and primary care offices, as we said, uh, find themselves with alcohol related disorders. So, uh, alcohol related traffic deaths, even though they've been cut in half since in the 80s, still 37% of traffic deaths are alcohol related uh, in those that we said. Um, Over 150 medications are additive or interactive with alcohol, especially drugs that depress the central nervous system. For instance, heroin, opiate, pain relievers, benzodiazepines, antihistamines, and antidepressants. That's the reason why a lot of times you'll see on medication bottles where they'll prohibit you from drinking alcohol with it. Uh, Tuberculosis, oral and esophageal cancers, colon, rectum, liver, female breast, diabetes, depression, high blood pressure, heart disease, and stroke. You have cirrhosis of the liver, pneumonia, or all related to alcohol use disorder, and also fetal alcohol syndrome. Um, they're like really dependent on how much a person drinks. So the more a person drinks, the higher those risks are with um, alcohol. Also, motor vehicle accidents and those type of things like that are increased as a result of alcohol. More than 150 medications are additive, like I said, and are related. Excessive alcohol consumption leads to increased effects on morbidity and mortality because it affects the entire body. The presence of alcohol consumption in a patient's history is usually a significant risk when a person has the development of some type of comorbidities. Up to one alcohol drink per day increases the risk of breast cancer by 4%. Everybody knows that there's a link between chronic alcohol use and liver disease. Heavy drinking and binge drinking are associated with increased risk of atrial fibrillation, and hypertension or high blood pressure tends to be the most common detrimental effect. Because of alcohol related morbidities, many patients will encounter um, going to primary care settings and hospitals, and they'll always have some type of significant drinking histories. Um, Alcohol dependent increases risk for sepsis, septic shock, and hospital mortality among intensive care unit or ICU patients. Excess of alcohol uses increases risk for ICU admissions due to trauma, hypothermia, and inflamed pancreas. Defining illicit drug use, illicit drugs. About 9.5% of Americans age 12 or older, and when you look at the age 12, you say, wow, or older are reported current illicit drug use. Illicit drugs are drugs which include marijuana, hashish, cocaine, including crack, heroin, any type of hallucinogens, inhalants, or prescription type drugs that are used non medically. About 1 of 10 adolescents are using some type of illicit drugs. So you're talking about 10% of adolescents tend to use some type of illicit drugs. Illicit drugs use has serious consequences for health, relationships, and future jobs, school, and career. Because when you're using illicit drugs, it'll affect you in all those type of areas. Abuse of prescription drugs is the fastest growing drug problem in the United States. The contributing factors include inappropriate prescribing by physicians, aggressive marketing by drug companies for off label use, um, belated government responses, and increase in prescriptions for pain relief in response to those practices of undertreatment of pain. Uh, those type of drugs that we're talking about would be things such as oxycodone, hydrocodone, and methadone. The misuse of prescription drugs has a huge impact not only on health and safety, but also on burdens to the emergency department. Substance abuse statistics. The rate of Americans classified with substance abuse or dependence, we have 8.5% of the population age 12 or older. 6.8% of those were dependent on or abused alcohol but not illicit drugs. And 2.8% use both alcohol and illicit drugs. Alcohol dependence or alcoholism is a chronic progressive disease that is not curable, but it is highly treatable. So it's not once an alcoholic, always an alcoholic, but it's treatable, but it's not curable. Accurate diagnosis is needed for advice, intervention, appropriate treatment, and or follow up. And when you diagnose substance abuse, the gold standard of diagnosis is well defined in the Diagnostic and Statistical Manual of Mental Disorder, the DSM 5. Alcohol problems are underdiagnosed both in primary care settings and in hospitals. Excessive alcohol use often unrecognized until the patients tend to have some type of um, serious complication. Uh, what is a standard drink? A standard drink in the United States is any drink that contains about 14 grams of pure alcohol. So that's only zero point 0.6 fluid ounces or 1.2 tablespoons. They have a chart which will tell you about in the U.S. is uh, what standard drinks consist of, um, and the types of brands that vary. For instance, a 12 ounce a beer or cooler is 5% alcohol. Um, a malt liquor, 7% alcohol. Table wine, 12% alcohol. Fortified wine, 17% alcohol. Vodka, whiskey, and that type of thing is 40%, along with things such as a martini or that type of thing. So a lot of times people actually they don't really look at it like that. They because like for instance, if you have a table wine, uh, the approximate number of standard drinks in a table wine is equal to 5. So that'll give you kind of like an idea. Uh, Standard drinks in a beer, which is 12 ounces, is equivalent to 1. So that's how you can look at it. If you see somebody drinking a 40 ounce, that is um, equivalent to like 3.3 standard drinks. So, like, they have it broken down where they have like what they call moderate drinking, at risk drinking, hazardous drinking, harmful drinking, or alcohol use disorder. And like they have it broken down where moderate drinking is considered less than 2 drinks per day in a man for a man, and less than 2 drinks, I mean 1 drink per day for a woman. At risk drinking is greater than 14 drinks per week, or greater or 4 drinks per occasion. For women, it's 7 drinks per week or 3 drinks per occasion. So a lot of times people will say stuff like, "Well, I only drink on the weekend," but when they drink on the weekend, they'll get towed up. They'll drink 3 or 4 drinks if it's a woman. Well, that's at risk drinking. Hazardous drinking is at risk for adverse consequences for alcohol. um, Harmful drinking is alcohol is causing a physical or psychological harm. And then alcohol use disorder, where the tolerance and level increases the amount to achieve effect. So they have to have greater than 2 to get any type of effect from alcohol. uh, and when they go through withdrawal, they spend a great deal of time trying to obtain alcohol, or craving alcohol. And then important activities are reduced because of alcohol. They drink more longer than what they intend. Persistent desire is there, as far as the efforts to cut down or control alcohol. And so, if it starts to affect um, your ability to, um, function like you should function, there may be some type of substance abuse problem. Among pregnant women, uh, it affects the growth of the fetus uh, during pregnancy and by going through the placenta, and it's metabolized and you know within the person's bloodstream, and that's why sometimes children will be born with alcohol toxicity, and that can affect their learning and all of that type of thing. So 18% of women, believe it or not, drink during their first trimester, 4.2 drink during the second trimester, and 3.7% drink during the third trimester. No amount of alcohol has been determined safe for pregnant women. Potential adverse consequences of alcohol use to fetus are well known, and all women who are contemplating pregnancy or who are pregnant should be screened for alcohol use, and they really should abstain from using alcohol. After the age of 65 or older, prevalence of current alcohol use decreases with increasing age. 41.2% drink alcohol, 8.2% are binge drinkers, and 2% uh, are what they call heavy users as um, they get older in life. So the amount or the percentage may be decreasing, but uh, you know that older adults, they may tend to have an increased risk when they use alcohol because the liver metabolism and kidney function in older people or decrease, which increases the like the level of alcohol that they will have in their blood for a longer period of time. Aging people lose muscle mass, so they can't absorb it and distribute it through their body. And then you'll find that a lot of older people tend to be on medicines that, or interact adversely with alcohol. Like they may be on antidepressants, they may be on antihypertensives, they may be on aspirin. Aspirin, because of cardiovascular problems. And as you know, the liver tends to metabolize, and what the liver does is it produces clotting mechanisms. But if your liver is not functioning, it will not produce any vitamin K or any type of clot mechanisms as well, and therefore, an older person or someone that's using some aspirin derivative or something like that could potentially bleed out. Also, uh, older adults may avoid detection, um, and they and they may get picked up more for DUI. Um, if they have alcohol related disorder, they may have an increase dementia. Uh, they may not rehab if they have some other problems going on in their life. Okay, so older adults have numerous risks that increase risks of alcohol use, and I might have went on into those. I did. I mentioned about the liver and the less tissue mass, and I did mention about the various type of medicines. Uh, and also, one thing I didn't mention was when they drink alcohol, they have a more increased risk of falls and increase of injuries related to alcohol use, and they can fall into a depression because of the fact that alcohol tends to be a depressant, and they can tend to have more gastrointestinal problems. Okay, so you would do your assessment and you would basically um, do your assessment, and you want to get a lot of subjective data from the patient. If the patient is currently intoxicated or going through substance withdrawal, you may not want to do or collect any data at that particular time because it tends to be unreliable. However, when they're sober, the person has to be willing and able to give reliable data, provided that the setting is private. Make sure that it's confidential. And when you talk to them, you don't want it to be confrontational. Like, well, you shouldn't be doing, just listen to them, give you the information. Okay. So ask about how much alcohol use they have. Do you sometimes drink beer, wine, or other alcoholic beverages? If the answer is yes, then ask screening questions about heavy drinking days, like how many times in the past year have you had 5 or more drinks in a day for men, or 4 more drinks a day for women. You know, you want to know those type of questions when you're asking them. Uh, so, to complete a picture of a person's drinking pattern, ask on average how many days a week do you have an alcoholic drink? And on a typical drinking day, how many drinks do you have? Recommend persons stay at a moderate drinking pattern. Recommend even lower limits or abstinence for patients who take medications that interact with alcohol, and of course if it's people who are pregnant or whatnot. So you'll use brief screening instruments to help identify problem drinking and those who need more thorough assessments while you're assessing. So when you're doing the audit of the patient, uh, and like sometimes using uh, the alcohol use disorder identification test, for instance, that is what they consider the audit. It has a total of, like, I think it's maybe 10 questions on it. And on the 10 questions, it asks about uh, like, how often do you have a drink containing alcohol? And 0 is never, and then 4 is 4 or more times a week. And then it goes down and it asks other questions. So, to reflect standard drink sizes in the United States, the number of drinks in question three was really changed to 6 to 5. A free audit manual with guidelines for use in primary care. You can find that on www.who.org, as far as the questions. And of course, the higher the score, you could say probably the more severe you would say that the problem would be for a person if the person was drinking. So they might have they have the maximum total of that being like 40. Uh, so you want to try to base, I guess you could say, your audit exam um, to what level, like for instance, a risk the person has when they're doing when you're doing assessment of a person. So, you would ask all of those type of questions when you're doing assessment audit. So there is the audit questionnaire. Um, you it's the most best type of thing to ask when you have a person that come, like let's say they come into the emergency room or something like that. That's when you would want to ask the audit, um, because they're more good for critical care units or people that's coming into the emergency room. And it may be somebody that you may not know that may have ever had any type of drinking problem or anything. Okay. So it is more like they got what they call a C audit, which is like it's kind of quick, it's shorter, a C audit questionnaire, and you can get up to, I think, 12 points, and a low risk is less than 2 points, you know. So it's like that. And most of the questionnaires will tell you as far as the risk factor. So when you do the audit C, right here it says it's the shorter form, helpful for acute, like I said. But note the audit covers three domains. It causes it covers alcohol consumption, drinking behavior or dependence, adverse consequences from alcohol, and that'll give you a view of whether or not or how the person is doing. Okay. Then they have what they call the CAGE questionnaire. And a lot of people recognize the CAGE questionnaire. And what it basically stands for is cut down, annoyed, guilty, and eye opener. The CAGE questionnaire, cut down, annoyed, guilty, or eye opener. So, and these questions are more kind of a straightforward type, you know, questions about uh, I guess you could say about a person when you're asking them about their alcohol drinking or alcohol dependence level. So you want to ask them about cut down. You want to ask them questions like, for instance, their ability. Uh, have they even tried to cut down or stop drinking, and have they been successful as far as doing that? You want to ask them about being, I guess you could say, annoyed when they are in a position where they might have not been able to get alcohol, or if someone ever says anything to them about their use of alcohol. You know, you're going to ask them about, do they ever feel guilty about using alcohol, and do they feel that they need eye opener? Do it help them in order, for instance, to just get up and get um going during the day? Then for specifically for women, they have uh if cage is not a good form of a questionnaire for a woman, they also have other forms of questionnaires, um like for instance, what they call tweak. TWEAK, and that stands for tolerance. Tolerance, like you asking how many drinks can they hold without them feeling high. Uh, Worry. Have any of your close friends or any of your family worried about it? That's the eye opener again, them needing it. Amnesia, have they ever been in a situation where they was drinking so much and they couldn't even tell you or remember quite what the section is? And then to cut down. Do you sometimes feel the need to cut down on your drinking? So you want to see if when they're answering these questions, do they tend to answer these questions with yes or no, or I do sometimes this. Uh, and if they get more than two answers to those questions or 2 points for those questions, well, then, yeah, they have a drinking problem. And that's how you assess those type of B. They have uh, all type of screenings. They got the short Michigan alcoholism screening test, and they have it's called screening test G, smart short Michigan alcoholism screening test, and um, you go down it, and it's 10 little quick questions, 0 to 10, and if they answer more than two, like yes, I'm having this particular problem, then that means that they have a drinking problem. One of them might be, do you usually take a drink to relax or calm your nerves? Do you drink to take your mind off your problems? Have you ever increased your drinking after experiencing a loss in your life? When you feel lonely, do you drink? Just that type of thing like that. Those are the type of question. And that's the short Michigan alcoholism screening test, or the SMAS. So you're going to ask all these questions, and you're going to be asking these questions, and you're going to be keeping in your mind about uh, uh, the audit, the cage, the tweak, and then the smashed G, and a lot of them have the same type of questions, but they do have these questions. You're going to make sure you ask about illicit substances as well. Right here is an example of the tweak that I told you guys about earlier. Uh, the tolerance, the worry, the eye opener, the amnesia, and the cut down. The smash G, like I said before, with aging adults. Uh, these are the questions I've explained. So you can advise and you can assist the person. Um, and you basically, the brief intervention is the consequences of substance abuse are so debilitating and destructive to patients and their families that a short statement of assistance and concern is given. If your assessment has determined that the patient has an at-risk drinking or illicit substance use, state your conclusions and recommendation clearly. You are drinking more than is medically safe. Relate to the person's concerns. I strongly recommend that you cut down or quit, and I'm willing to help. If you determine the person has an alcohol use disorder, state your conclusion and make sure that when you recommend, whatever you recommend that particular person, make sure that you do it really, really clearly so that they can understand. There are a lot of objective clinical laboratory data. They are not as sensitive as self-report questionnaires, but they can help corroborate any subjective data. A lot of times they'll do a GGT, and that's a marker of alcohol drinking. It's one of the proteins uh, that you find when, I guess you could say, when the liver is not functioning very well. Occasional alcohol drinking will not raise this measure, but chronic heavy drinking will. Because be aware that non-alcoholic liver disease also can increase GGT levels in the absence of alcohol. So you just got to know that just because their GGT is elevated or whatever, that does not mean that it's necessarily because of alcohol, but you can correlate it to alcohol, the GGT level, if you have done a number of these questionnaires and they tend to fall together. Okay. From complete blood counts, the MCV, which is the mean corpuscular volume, is an index of red blood size. The MCV is not sensitive enough to use as only a biomarker, but it can detect earlier drinking after a long period of abstinence. Breath alcohol analysis detects any amount of alcohol in the end of exhaled air following deep inhalation. This measure can be correlated with blood alcohol concentration and is the basis for a legal interpretation of drinking. So, uh, if you take, for instance, the vital signs, vital signs of a person, and the vital signs of blood pressure, pulse, respiration, O2, all of those type of things, it can help you assess where the you know where a person is, whether they having withdrawal symptoms or uh, if they have depressed drinking, or I mean, it could be, I mean, respirations because of drinking and those type of things like that. So, so those are what is considered like clinical institute withdrawal assessment. Uh, or they having delirium tremens, or do they, or how bad is it actually getting? Know, you guys, also that a blood alcoholic content level of 0.08 is considered legally intoxicated, and in most states that may equal 3 standard drinks. Uh, Withdrawal symptoms from alcohol might be, a person might be irritable, they may have a loss of appetite, they might have abdominal pain, they may be tired, they may have chills and muscle cramps, heart palpitations, hypertension or high blood pressure, disorientation, slurred speech, gait is poor. Um, those are the type of things that you might be looking at. When you look at abnormal questionnaire, like with the Clinical Institute for Withdrawal Assessment of Alcohol Scale, which is CIWA, just know that that's an assessment of alcohol withdrawal. Clinical Institute Withdrawal Assessment of Alcohol Scale. It focuses in on nausea and vomiting, tremors, uh, paroxysmal sweats, anxiety, or they have an agitation, or they have tactile disturbances and hallucinations, or are they having auditory disturbances in it. I mean, this is like once a person is over there. You know, they'll have visual disturbances, headaches, or they not oriented. Though that is when a person is really, you guys, like really, really, it's really getting bad. Okay. So I want you guys to recognize and know um, the difference in various terminologies as far as drug usage. For instance, there are some definitions. For instance, when a person is intoxicated, that person's ingestion of substances produces what they consider maladaptive behavioral changes because of the effects of the central nervous system. Abuse is daily use needed to function and the inability to stop. They have problems with social and occupational function, and it's recurrent, even though they may have uh, legal problems or anything. That's when they in the abuse. Dependent is a physiological dependence on the substance. Tolerance is when a person needs a more than what you would think they would need to even get the effects of that particular drug. And then you have withdrawal, which is once you stop, the person has some type of uh, effects as a result of them stopping, some type of physiologic symptoms. So, know the definitions of intoxication, abuse, dependence, tolerance, and withdrawal. I'm telling you guys that this is in your book, and I do want you to be aware of it. Okay, so prescription drug abuse is, yeah, everybody knows that that's a growing epidemic out here. And I just want everybody to know what it's about. And it occurs when an individual takes medication that was prescribed for somebody else, or they take medication in a manner that is different from what is described. They may say, well, I hurt my back and the doctor prescribed this amount, and instead of them taking one every 4 hours, they're taking two every 3 or 4 hours or whatever, and they running out of medicine easily, and they're they're seeking the medication to make them feel better. They're, and then it gets to the point where you don't know whether or not it's the actual, I guess I could say, drug that they're taking that's making them feel bad if they stop taking it, or whether or not it's really the pain that they was having, maybe they was having from the back injury. So it's a very complex and difficult thing to treat. I want you guys to know they have clinical signs of substance use disorders. There is a table that says clinical signs of substance use disorder based on the substance. They start with alcohol, and they go to sedative hypnotics, which is benzodiazepines, uh, nicotine, cannabis, which is marijuana, cocaine, including crack, amphetamines, and then opiates like morphine, heroin, and meperidine. So out of those is one, two, three, four, five, six, seven. So those 7 different substances, I want you to just read it and just kind of see if you could put it together of the type of appearance the person may have or the type of behavior that person may have. Like, for instance, people on cannabis, they have reddened eyes, they have a fast heartbeat, they usually have dry mouth and increased appetite, and they really love junk food, and they may have a little loss of balance or coordination. They usually are euphoric. They usually have a pleasant state of relaxation and tranquility, uh, slow time perception, increased perceptions, impaired judgment, social withdrawal. Sometimes they might get anxious or suspicious or paranoid. This is the behavior of people who take cannabis. As far as them being in any type of withdrawal, uh, no withdrawal with occasional use. Uh, if they have a chronic or heavy use, like you know how you know the person that sit up and smoke weed all the time, they'll have a mild withdrawal, which can include irritability, sleep disturbances, weight loss, loss of appetite, and sweating. And that's over time, like somebody being on it. So they have those 7 different drugs I mentioned, which is alcohol, sedatives, nicotine, cannabis, which is marijuana, cocaine, which is including crack, amphetamines, I'm going to say that again, and opiates. And within those various things, I want you guys to make sure that y'all kind of give an idea or just try to think about a thought process of like, okay, how would this person act maybe if they was going through withdrawal? How would that person look or act if they was currently using that particular drug period? And just kind of see if you can kind of think about it and put it together. Also, just like I did with the first video that I did the first video, which was on mental status. I posted a couple little quick little videos, but for this one, for substance abuse, chapter 6, you'll see where someone actually they're doing a role play of, it's a physician, it's a doctor. I don't know if he's a medical physician or maybe a doctor like of psychiatry or something, or psychologist or whatever, but they're interviewing somebody about, substance abuse. And I'm thinking, and they're acting it out, but I wanted you to just pay attention to how he's asking the questions and how that person is answering the questions, and just how like non-judgmental it is at the same time, but he's getting the information that he needs from her, and how you can make a person essentially cooperate, with you. So okay, so that's the end of my lecture on substance abuse. Know that each one of them have little informative videos that are really interesting, you guys, to watch, and it'll help you learn as well. And please continue to listen to my videos. Even if you can just upload the videos and listen to it when you're driving, or just listen to it in your ear, that's better than nothing.